I wanted to share a story about one individual that really triggered my motivation for the kind of work I do. So this was when I was a postdoc working on Huntington disease. And every year we had an event like this where people came in and they could talk to the researchers. And I remember one grandma, kind of reminded me of my own grandma, that stood and said to me, "My husband died of Huntington disease. My son has the disease now. My grandson has just tested gene positive." And she wags her finger at me and she says, "What did you do for us today?" And I took that away with me. And every day since then, I have been up in the lab working very hard to try to make life better in the ways that I can behind the scenes of what you see in your clinicians' offices, to make life better for neurodegeneration and neurotrauma. So what I'm going to share with you today is some of the excitement and promise we have to develop blood tests for neurological conditions. And I'll focus on concussion for today. But this concept can be applied to stroke, to spinal cord injury, to many neurological and neurodegenerative diseases. So the program that was started in my lab a few years ago with the generous donation of a very special piece of equipment is launching all of this leading research in Canada today. This research would really not be possible or not be this easy in other environments. So we hear a lot about concussion in the media today. This graph really gives an indication that concussion can happen at any age. At the bottom of each bar, you'll see the age groups 0 to 4, so these are young children, 5 to 14, small kids, adolescents and young adults, and all the way through up to people that are over 65. Over 2.5 million concussions happen every single year. And these are across the age span. And in fact, the largest group of people that are having concussions are people over 65. It's just because we're living longer, and with age, falls happen more frequently. So we need to study concussion across the entire age span. Now, this is very challenging because for most people, you really don't have an idea of what their life was like before they had their concussion. So this is why we study sport-related concussion most, because we can do really good studies on sport-related concussion. And here are some statistics on sport-related concussion. 50% of Canadian youth who play sports have had a concussion. 50%. A lot from hockey, a lot from soccer, not so much from heading the ball, but from colliding with another player or hitting the head on the ground. Even sports like horseback riding can have a high concussion risk. Of these 50%, 70% of the concussions in youth are from sport. So it's the largest group or the largest cause of concussion in our youth. And of those 70%, 30% of those have recurrent concussions. So these are most often the hockey players, the athletes that play contact sports. So they have more than one concussion. And 30% of these individuals can remain symptomatic for more than 1 month. Now, most people with concussion recover spontaneously and are back to normal within a week to 2 weeks. But about 20% overall of people with concussion have prolonged symptoms like headache, like light sensitivity, like just feeling off, a little bit dazed, just not feeling right. And there's actually very little that we can do other than ask a person, how are you feeling, to be able to appropriately diagnose a concussion and offer the right sorts of treatment. One of the challenges is that the biggest symptom of concussion is a headache. But headache can come from a lot of different things. It's not really specific for concussion. And there's no way for us to measure how hard or how bad a headache is. It's something that the patient feels themselves. And it's really not something that we can measure, we can quantify. So this is where we are trying to develop new ways to diagnose concussion and monitor recovery. And as I said before, these principles extend to many other conditions. And this is what everybody's worried about. This is a disease called chronic traumatic encephalopathy. These are brains of football players who died, National Football League players who died. This shows the progressive evolution of chronic traumatic encephalopathy. This is a disease that can only be diagnosed after death when you examine the brain and you see the brown stains that you see here. This is tau. This is the same tau that you find in Alzheimer's disease, but it is the defining characteristic of CTE brains. And all we know so far is that it first starts showing up in the very bottom of the folds of the brain. And this is, you can see this in the stage 1 and especially in the stage 2 of disease. But similar to what Neil just told you about, this tau can start spreading through the brain. And that's when you see the stage 3 and stage 4. Now the arrow that you're seeing that becomes black in stage 3, this is pointing to the area of the brain that really controls your memory functions. And this is when CTE patients begin to exhibit cognitive changes that are very similar to what we see in Alzheimer's disease. And then the disease just gets progressively worse. Now, as I said, there's no way to diagnose CTE in a living patient yet, but there are many, many questions that we need to know. How many concussions does it take to get CTE? How many NFL players have this? What you'll read in the papers from the studies that are being conducted mainly in Boston are very dramatic statements, like 98% of brains from the NFL players have CTE. There's a lot of subtleties to that statement, because all of these brains were donated from players who really felt that there was something wrong with their brain. We do not yet have a way to unbiasedly check every national football player, every national hockey player, and see what their risks are. We don't know if recreational sports may be as risky as professional sports. And really, we don't know how to make sure that that player recovers completely before they're put back on the ice. But this is really what we're trying to do. Okay, so this is a little cartoon of a neuron. And the part that's wrapped in green, that's called the axon of the neuron. And that's really a lot of, it's like the highway of a neuron. Neurons are really, really long. The cartoon doesn't really give it to scale. But if I was the cell body, the place that you have the little orange dot in the middle, the typical neuron would go like right out to the elevator, for example. And that axon is like the highway where things have to travel up and down that highway of the neuron. Now, when a neuron is stressed or damaged in some way, it releases proteins that we can measure in the brain. And what I'll highlight are you can see NFL up there. That doesn't stand for National Football League, although the irony is really there. What it stands for is neurofilament light. And this will become a very famous protein because it seems to be the best candidate to develop a blood test for. So we know that when a neuron is damaged, the neurofilament light will leak out of that damaged neuron. And our challenge is, how do we measure this? So this is the answer. This is a revolutionary technology. And because I was fortunate enough to have a donor generously support the acquisition of this machine. I am the only site in Canada that is able to run these tests. This machine is called single molecule array, and it is capable enough, it is sensitive enough to detect one single molecule of any analyte that you need to measure in a lab test. So we're developing assays for neurofilament light. Essentially, to be able to detect something that is released from the brain, only some of that gets from the brain to the blood, and then it's diluted so much in blood that we really have a challenge in measuring it accurately. What we need is something on the order of this sensitivity, which is like the ability to detect a single grain of sugar in an Olympic-sized swimming pool. That's how sensitive we need these tests to be. And this machine can do it. So over the last couple of years, we have been developing our approach to how we will develop and implement these blood tests. So these graphs give you some idea of the types of data that we have generated so far. So what you're seeing here are data from the largest study of pediatric TBI, traumatic brain injury, to be conducted in Canada. The lead institution was the Hospital for Sick Children, and they sent us all of their blood samples to measure. And what you can see here on the very left-hand panel, panel A, is the levels. This is a different test for tau as opposed to neurofilament light, but the concept is similar. So control patients are ones that do not have a brain injury. What you see is labeled GCS 13 to 15. These are in the concussion or mild traumatic brain injury range. And then as the GCS numbers, this stands for Glasgow Coma Scale, as those numbers go down, the severity of the injury is greater. And you can see that this test, this tau test in this case, can detect differences between control patients and patients with brain injury. What is really exciting is that there's really never been a way for a test to really pick up kids that are perfectly normal, GCS 15, versus those that have a subtle change in their clinical presentation. And in panel B, this test of tau on this special machine, this Simoa machine, is able to separate out kids that are GCS 15, that is perfectly normal, versus the ones that have a concussion of 13 and 14. And if you look at the panel on the right, we can see here that the levels of tau in the blood match those kids that have bleeding in the brain when you do a CT scan. The reason that this is really important for children is that we don't want to put every child into the CT scanner. The CT scan has some radiation associated with it. And we know that exposure to radiation with a CT scan can increase risk of brain cancer in kids. So we're really stuck when we have a kid in the emergency department with a concussion. The thing is, CT scans only pick up brain bleeding in maybe like 1 of every 100 or 200 kids. So you're going to scan that many kids and only pick it up in 1. Do you really want to expose all of those kids where you don't have bleeding in the brain to that radiation risk? So Canada has rules for how to choose which kids should go for a CT, and these sorts of blood tests are expected to help improve those decision-making tools. So we can do a blood test, and if the kid is higher than they should be on tau levels or neurofilament light, then off they go to the CT scan and receive appropriate care. One of the things that we're really excited about is the ability to tap into large biobanks that already exist. As I said before, most children will come to the emergency room, or most anybody will come to the emergency room after they've had their concussion, not before. Right? That makes sense. So how the heck do you tell if they're getting back to normal if you don't know what they looked like beforehand? So this is where the concept of normative data can help us. There are major biobanks in Canada. This one is called Caliper, and it has collected blood samples from close to 10,000 healthy children from age birth up to 19. These are kids that they're just absolutely normal, healthy Canadian kids across Canada. And these blood samples have been used in the past to develop the pediatric versions of most of the blood tests that are being done today. So these sorts of biobanks can help us to define what the cutoff levels should be in a healthy population, so that we can then, let's say that you have a 12-year-old boy that comes in with a concussion. Then we look at these sorts of data and we say, okay, what should the normal levels be for 12-year-old males? And this is how we can then be able to detect if a person has a higher level than they should, and how they're coming back to normal. So we are about to publish these sorts of data that give us the cutoff values that the lab tests need for their interpretation. And we're growing this with a fabulously new and wonderful opportunity to partner with Statistics Canada to develop these blood tests. So Statistics Canada actually has a survey where they talk to 22,000 Canadians every 2 years. That's a lot of people. And from those people, they collect blood from about 5,700 of them. And those blood samples are stored in Winnipeg, and I've been able to get approval to get access to this huge biobank. So this means that we can develop what is normal for any biomarker for neurodegenerative disease or neurotrauma from these samples. And that means when anybody comes to the emergency department with a concussion or maybe with a stroke, we can determine if their levels are okay or not. We can also use this relationship with Statistics Canada to work toward developing a public health blood test screen for dementia, much like we go for a diabetes test or you get your cholesterol tested. This partnership with Statistics Canada and our ability to measure these biomarkers in the blood will get us there. So this is what we're very excited to be able to share with you today. There's a lot of other details about the technologies that we're trying to use and make these tests accessible to anyone in Canada, even if they live remotely. So the years ahead will be incredibly exciting. And once again, I would like to thank the philanthropic gift of this Simoa machine that has really launched this whole program, and the ability to work with so many clinicians in this building and across Canada to be able to bring these blood tests to fruition. And we hope that Canada will lead the implementation and development of these blood tests for concussion, stroke, trauma, and neurodegeneration. So thank you so much for your attention.